Hi, and thanks for joining me. This is the show where regular people like yourself get to share real experiences and insights about pain and life. In these casual conversations, we're usually talking about a type of pain that strikes from out of the clear blue, while we're just living life, often doing everyday things that we've done with no problem before. But for some reason, one day, the body suddenly decides it's just had enough. I'm your host, Yaling Liu. I'm a chiropractor, and some of these guests are my patients. I've been working with bodies in pain since 1994, and one of my favorite parts of practice is still the time I get to spend connecting with people about life as it relates to their pain. Some of the most significant breakthroughs that I see in practice happen through conversation. It's during these frank discussions that we often stumble upon realizations that can help us move forward. And this is exactly why I want to share them with you here.
You're just doing what you should. Doing what you should. You're just doing what you should.
If you think you might be offended by morbid humor, be warned. There are some slightly irreverent references to death later in this episode. Humor, perspective, and life experience is just some of what today's guest brings to the conversation.
My name is Alice Gilbert. Managing your body as you get older is an interesting challenge because it's deteriorating and it's going to continue to deteriorate.
Alice is 86 at the time of this interview. Now she's 87. You would think, especially those of us who are preoccupied with the emerging pain science and the biopsychosocial piece of that using words like deteriorate would predispose someone to a dismal outlook and greater suffering. It's something we refer to as Nocebic language. In the opposite way from how a placebo can make us feel better, nocebos make us feel worse. If you believe something is bad for you, it ends up being bad. Research is showing us that when we use language that signifies inevitable decline, it can accelerate the process and enhances the experience of that. True to Alice's character from what I now know of her, she again deviates from the norm to show us that it's all about context.
All pain is registered in the brain. So therefore, if you are consciously addressing pain, you can also mitigate it and don't need medication except for the occasional over-the-counter stuff. There are so many accounts of various medications affecting your mental abilities. I am not that expert in that field at all. However, I don't know how to account for the fact that I'm still functioning fairly well. Believe me, I have my moments of forgetting names and all that kind of good stuff and what I went into the kitchen for. But
do you know that there's actually an official list of both over-the-counter and prescription medications that are not recommended for people over a certain age group? As we get older, the adverse effects of some drugs on our cognitive or brain functioning can be amplified to a dangerous degree. For older adults, any added or unexpected impairment to the brain and nervous system can make a massive, life-altering difference between independent living at home and hospitalization. And hospital stays carry a whole other risk for our geriatric loved ones. There are too many medications to mention here, but I've included a link to an online resource with more information in the podcast blog post over at stopeverydaypain.com. Please do take a look when you have a chance. You might be surprised to find that the list includes things like Benadryl.
I think that some of that is just staying active. I'm involved with my family. I've got a good friend circle. I live in a condo building. We have a book club. Several of the women wanted to learn how to cook, so I'm teaching a cooking class. When you have friends that are young and old and everywhere in between, I think it challenges you to keep up.
Do you have friends of different generations? For many people, extended family provides this sort of multi-generational interaction. But what do you do if you don't have a big family? Because Alice is absolutely right about the value in this. Research does in fact support the same point of view and has led to the inception of elder housing situations in some European communities where young people are encouraged or incentivized to live alongside the older generation. The hope is that they can offer a little bit of extra support around the house and companionship. I recently heard about a program just like this that was started in Ontario, Canada, for students of McMaster University. It connects students who are looking for affordable housing with seniors who have a spare room. And in exchange for a furnished room, the hope is that they can offer a little bit of extra support around the house or companionship for their hosts. This program was started by someone who had this experience in France when she was going to school abroad. Hopefully, we'll see something like this in the US before too long. Since Alice is happy to be an open book and gave me her permission, I can tell you that she is a patient of mine. The majority of treatment has been geared towards back pain and neck pain in no particular order. You'll hear her mention a specific kind of arthritis. Hers is one that's widely considered to be related to joint wear and tear. But that's an oversimplification. It's not purely mechanical, and it's definitely not a guarantee of needing joint replacements, which Alice will tell us a bit more about later, since that happens to be her experience.
I have arthritis, osteoarthritis, and I've had 5 joints replaced, and it's also in my back. When I am especially active, my back starts to ache. I sit down and it goes away. And then I get up and do something else again.
When she first came to see me, it was at the recommendation of Alice's forward-thinking medical physician to address not only her back pain, but also to see if the impact of chiropractic treatment might alleviate another symptom she'd been having for a few years. It was something that seemed at the time to be more of a cardiovascular nature. Given that all routine testing showed no other medical reasons for concern, I was happy to see for myself if there could be any benefit outside of the usual. A big part of a calming manual therapy treatment of any kind is the impact it has on the nervous system. Down-regulating the fight or flight response is hard to measure, but can be far-reaching in ways that we can't always explain. So what was this mysterious symptom?
It's been going on for years. What it is, and I call it a rough idle, because that's what it feels like to me. Just like a car will go ka-chuck, ka-chuck, ka-chuck. The heart is going instead of its regular beat. And I can feel pain in the chest, pain running down my arm. I was shocked when it first happened. It was in California. I was visiting my daughter. I couldn't think what to do, whether I should call the 911 or what. So then I thought, I know how to meditate. Well, meditation affects the heartbeat. It happened when I was taking a walk. I walked over, sat in somebody's steps and meditated, and it went away. Periodically, it would come back, and I'd meditate, and in a couple of minutes, it would be gone. And then as I got older, what I discovered is that it was happening more frequently. So I went the round of cardiologist. I had a nuclear test, blah, blah, blah. No one knew why it was there. And they were going to put me on medication. But I thought, well, if you don't know what's causing it, I don't want you just to throw medication at it, hoping something will stick. And I'll just, every time it happens, I'll meditate and it'll go away. Then one time, my GP, I do go in once a year for a physical, he discovered that the hypothalamus, now that I was getting older, was not producing what it should. He gave me another thyroid-like medicine. I do have an underactive thyroid gland. And lo and behold, that caused the rough idle to be almost non-existent. It'll happen now and again, which seems to indicate that the problem was not in the electrical system of the heart or any kind of blockage, but was actually a metabolic problem.
If you haven't already noticed, Alice is very engaged in her healthcare, and she informs herself regularly about current thoughts in medicine that might affect her. I do regularly see a correlation between how informed someone is about the body and how well they respond to care. If it were up to me, all of us would get ongoing anatomy and physiology education starting in grade school. And I believe it's this more detailed knowledge about the body that can help us better know when we need help and when we can handle things on our own. What I'm curious about is how you so quickly went from, oh, this, should I call 911? And then, oh, I can control it.
I guess because that's my approach. My approach is to do it the most natural way. I just try things. If it had persisted, if the meditation hadn't gotten rid of it, then I would have called 911, I suppose.
Do you ever remember having pain or having a health experience that scared you, that made things feel worse, or that felt out of your control?
Well, I think a lifetime of experience of questioning the medical system. Now, don't get me wrong. I am in awe and I have a great deal of respect for the medical community and the research that goes on and all of that.
You've certainly been on the receiving end of a lot of mainstream, good, successful procedures.
Absolutely.
Yeah.
I couldn't be happier with my 5 joint replacements. I have no pain at all because of the skill of the physicians and the appliances. In the 60s, when I went to have my children, at that time, everything was induce the woman, strap her down, get her heavily medicated. And I had read a book by Dr. Grantley Dick Reed, and he was kind of the precursor of Lamaze, and he was talking about a more natural childbirth. I'm thinking to myself, Jiminy Christmas, Native women go squat in the jungle, have a baby, get up and do their gardening. So why are they telling me I need to be anesthetized and strapped down and all this kind of stuff? So I went to a teaching hospital in Danville, Pennsylvania, Geisinger, and told them how I felt about the approach, at that time, the popular approach to women giving birth. They had heard of Grantley Dick Reed and the breathing that is very similar to Lamaze. And they agreed to cooperate with me and allow me to have a more natural childbirth.
Dr. Grantley Dick Reed was a British physician way back in the early 1900s. He published a book called Natural Childbirth in 1933, and later one called Childbirth Without Fear. He was, in fact, ridiculed for it, and apparently he even got kicked out of his own clinic because of this controversial view of his. Luckily, there's been much progress in women's health since then.
It was a case of saying no to the current fad in the medical system at that time for giving birth. And the same was true of breastfeeding. At that time, you were discouraged from breastfeeding. You were encouraged to bottle feed. And that made no sense to me, because having to get up in the middle of the night and warm a bottle when all you have to do is unbutton and roll over, there was no contest. So I guess you could say that from the very beginning, I didn't reject the medical system, but I questioned it. It's worked very well for me.
I'm a big fan of Alice's questioning style. Saying no to current fads and standing up for what feels right and natural has given rise to a resurgence and continuing growth in the field of midwifery. With that has come an increasing recognition by hospitals even for the value of the birthing center experience, where women can choose natural childbirth with a midwife. I coincidentally had the chance to chat with a longtime pal of mine, Paula Pelletier Butler, who is the founder of the first and only accredited birthing center in Flagstaff, Arizona. I hope to have her back in future episodes. There's so much more to talk about. This chat was just done on the fly, and we didn't have time to really dig in, but I did get the chance to ask her for a bit of her perspective on the pain of childbirth, as someone who's not only been through it herself multiple times, but also has now guided countless women through it too. What is it that makes the pain of childbirth something that women choose to go through, like Alice did?
Because it's pain that has such an amazing outcome. It's finite, and it serves a purpose, and it's pain that is physiologically normal.
Oh, that's a good way of looking at that.
Yeah.
Huh.
So it's your only normal, physiologically normal pain.
Right. it doesn't signify dysfunction in any way.
Right.
I hadn't even ever thought of that.
Right.
Huh.
So that's kind of cool to tap into. You know, it's a pretty neat thing to tap into.
There's this commonly held belief, which isn't necessarily accurate, but nonetheless, there's this notion that you've probably heard too, that women have a higher pain tolerance than men, and generally it's tossed about with the idea that it's because they go through childbirth. Thinking of labor pain as the only normal pain that's not related to dysfunction raises the point that for women who have had positive natural birthing experiences, their context for pain is completely different than for men and women who haven't been through it, or who have only had scary pain. And pain science is finding that context is everything. It shapes outcomes. It has to do with predictive brain associations. The brain uses past experiences to inform future experience. So perhaps choosing natural childbirth is a form of shaping positive expectation in regards to pain.
If someone wants to meet me at that place of trying to have this baby without any pain medication, then I'm pretty jazzed to sort of guide them through that process. Because that's already a decision to embrace this pain, more so than saying, I'm going to try not to get an epidural when I'm at the hospital. By choosing a birth center, it implies that you are embracing the pain of childbirth. Because there are no options there. I mean, other than transfer, which we can do, and it's fine if we have to. It's totally fine.
It's important to note here that Paula was sure to tell me from her vantage point, there's absolutely nothing wrong with choosing to not go through natural childbirth. Everyone has their own path, and choosing what's right for each of us is what matters most. Let's get back to Alice's excellent skills at challenging the status quo. Where does that come from? That questioning, and do you think it's your education? Is there something in the home that is your family's orientation about healthcare different, do you think?
No. Both my parents were tenant farmer children with no more than 6th or 7th grade education. I always question authority.
You must have been a fun teenager.
Oh, yeah. There are stories there. No. I just have always questioned whether it's religion or the medical or the world politics or whatever. I just have always questioned.
I'm guessing Alice must have developed an inner sense of her own truth at an early age to even know that the world around her may not reflect what is true for her and her body. How this knowledge forms is beyond my qualifications to understand. Are we just born with this? Or is it something that is either fostered or squelched in childhood development? So how did Alice decide that joint replacement surgery 4 or 5 different times lined up with her inner truth? Here you are, with 5 different joints that are titanium or... Yes. It's amazing to me that you're very comfortable. You've changed my mind about surgical procedures, knowing and seeing and working with your body. I see how amazing they can be.
There was no choice, really. It started, I had both knees done at once because they were both bad. And it was either that or a wheelchair because they were just that bad.
Wow.
They were worn out. So you go, you find the best person that you can, and he did a really good job. He also, the same doctor, did my hip because that went bad. But what happens is the level of pain. Now you can go along and you can take ever increase. You get shots of steroids or you can take heavy duty pain medication, but that's not going to fix it. And I'm a person who fixes it if I can. If I can't, I live with it. But if I can fix it, I will do that.
It takes a certain determination, for sure.
Well, yeah, I guess. But, the difference between being pain-free or being in a wheelchair, there's almost no choice.
There's a pretty fine line between pain that we worry might be a sign of needing joint replacement and pain that actually does signal that it is time. Knowing what I do about Alice, I have no doubt that she did truly have no other option by the time she sought help. it's still important to get second opinions and do your own questioning as you learn more and more about your own body so that you can choose what's best for you. And you have to remember that most pain does not actually signify tissue damage or serious decline.
What was the approach to that point like? You must have been experiencing a lot of pain for a long time.
Well, at first I'd have a flare-up, and then it would go away. And then eventually the flare-ups became more frequent, and then eventually it didn't go away. And so it was just at that point that I said, okay.
Quality of life must have been affected quite a bit.
Yes, it was. Yeah. It was.
This sort of constant pain seems like good motivation to face the pain of surgery and the pain of knee rehabilitation. But how did Alice manage that post-surgical pain so many times?
So you must have had some faith that the pain would end.
Yes, that's just it.
Yeah.
You knew it would end. I don't think I've ever had pain that you can't put up with and mitigate. If you're saying to yourself, oh, God, this is awful. This is terrible. Well, it is, if that's what you believe.
Right.
But conversely, if you say, well, this will go away, it will heal, it isn't so painful then.
I wonder if this is an outlook that she gained from going through the experience of that one physiologically normal pain of natural childbirth. Was it the approach of Grantley Dick Reed that helped her take this attitude into the rest of her life? She did have 3 children, all naturally, without epidural medication. Is it possible that this would have provided repetitive reinforcement for a reassuring, generalized pain perspective? That it will end, and it does get better. Here's Paula again talking about the role of midwives and doulas during exactly such labor, ones that progress well and without complication.
Particularly for second, third, fourth, whatever time moms. When birth is happening, there's not a lot except for that focus on helping her with the pain. Getting in the shower or getting in the tub or massaging their low back or particular positions or the TENS unit. We have a TENS unit,
yeah.
you know.
So it really is about giving them the window into, it will get better.
Mm-hmm.
So they know it's going to be okay and it's going to end.
Mm-hmm.
Since Paula specified that she's talking about women who have given birth before, I'm guessing that in the world of childbirthing, at least for first-time moms, there's probably much more that needs managing during labor rather than just pain control. I can imagine that shaping expectations, even leading all the way up to labor, plays a major role in how things go. There's always a chance that things don't go the way we expect in all things, but our expectations can have a huge impact on the experiences that follow, good or bad. The trick might be to stay flexible and find a way to adjust those expectations as the situation changes.
You're good at adjusting your expectations.
You have to. That's key. Absolutely. Otherwise, you're always fighting it. And if you're fighting it, you're in a negative space and you're magnifying its effect on your life rather than trying to work around it.
A quick side note here. Something to be aware of is that our wishes are distinctly different from our expectations. We can wish for a positive outlook or a positive outcome, and at the same time, without wanting to, we might still expect things to go badly. Subconscious thought patterns are not easy to overwrite, but we all have them, and there's no shame in getting help with figuring that out. That's one thing that therapists are for.
I would say I had pain-free days, but it depends upon what I do. I do something until the back starts to ache, then I sit down and it goes away. Or I wake up and just recently I did something to a shoulder. I have 2 artificial shoulders too. And did something to a muscle or whatever. And that ached for 3 days, but then it went away without medication. I just ignored it and did my regular activities and
that's going to be my advice. Just ignore it.
Just ignore it.
Ignore it. Enjoy life.
Ignore it and go on.
Yeah.
And in ignoring it, you are minimizing it.
It's true. It's true. And then I run up against this, and I agree with you about that because I see how well it works for you. And then I see the people who ignore pain for too long and they end up in chronic pain and don't really know how to get out of it. They make it worse somehow by ignoring it.
Well, that goes back to knowing your body. Ever since my 40s, when I first found out about diet and cholesterol and all that kind of good stuff, I get literature, which helps me to know my body. You really have to pay attention to it. And it's not going to be a pill or a doctor, although they can assist if necessary. But it's paying attention and staying tuned. Mm-hmm. When I wake up with the shoulder that I just talked about, that's very evident that it wasn't anything really bad. It was just a pulled something or other, and I could ignore that.
In order to know what's pain that you need to pay attention to and what's just regular pain, you must have had a wide array of experiences.
Right, exactly. Yeah, like I said, knowing your own body and taking responsibility for it. I had an itching in a place where the sun doesn't shine.
That's right. I'm remembering that.
You remember that?
Yeah.
And I had not, because I'm in my 80s, it's no longer necessary to go and get a yearly or every 2-year gynecological exam. It just isn't. And nobody recommends that. But I thought, I haven't had this before, so I'll go get it checked out. I went to my GP, who's a wonderful doctor because he is oriented toward the natural. And I got a name from him and went to a gynecologist, and she saw something suspicious. So she sent me over to a cancer doctor, and indeed it was. But it was in stage 1 because I caught it.
Yeah, you paid attention.
You pay attention.
Yeah, interesting. That was really a unique experience of all the melanomas where there's no sun. So ironic. Like, what's going on here?
Yeah. After all that sunscreen,
Right. It found a way.
It found a way in the dark.
Oh, that's funny.
It is, and that's another thing. Keep your sense of humor about your body. Well, keep your sense of humor. Period about that kind of thing.
Speaking of keeping your sense of humor, here comes the part in our conversation that might not seem funny to everyone and is definitely a bit morbid.
I'll relate something a little macabre. I had decided that I'd seen an article in the paper about donating your body to the University of Washington. And so I went through the process. I was telling my 2 sons about this my daughter lives in San Diego, so this kind of thing is usually run through my sons. And I was telling them, and they share my sense of humor because I was telling them they've got to get me there while I'm still fresh.
That's one of the stipulations.
That's one of the stipulations. And anybody who would read the emails that were going back and forth would thought that we were a bunch of ghouls.
That's so great.
Humor.
That impresses upon them the need to make sure to check up on you.
Yes, that's true. Yes.
Don't let that body rot.
But it's that,
Yeah, it shows how much you embrace that complete start to finish.
Yeah.
And
it's so much easier.
Yeah. That really sums up a lot of the things that I really enjoy about our visits is your perspective on life and how you cope.
Life is really, even with the current political situation, there's so much joy in life. You have to be open to it. It's so rewarding if you are.
Do your children how do they approach pain and challenges in life and things like that?
The same way that they really do, I think. Yeah.
Do you think that's because of you?
Well, I think all 3 of them are rather matter of fact. And the 4 of us, we have the same spiritual system. There's not a lot of fear associated with pain. We're very matter of fact and natural. In other words, you're getting old and the body's going to ache and it's going to deteriorate. We're just natural people, I guess. And the same is true about death and dying. I'm just not afraid to die, and I don't worry about it. Right. It just isn't something that affects my approach to health.
That's great.
It's inevitable, and whenever it happens, it happens. At 86, you acknowledge that you don't have that many more years, but it's not a concern. It just isn't.
Do you feel like there's been an effort to get to that mindset, or is this a natural inclination?
I suppose circumstances, I didn't certainly think that much about it in my 40s and 50s. It's more like the older you get and your body presents you with aches and pains and evidence of its deterioration, you think more about it. You think more about the end of it because you're experiencing a deterioration. As far as the approach to death, I guess it's a whole spiritual belief system that I've built up over the years.
Alice's choice of words here is very intentional. A spiritual belief system doesn't necessarily have to fit into a traditional religion box. Faith is something that can exist with or without specific religious beliefs. Faith in science and medicine can be just as powerful. I say whatever works for you to minimize the fear.
I raised my children in the Quaker meeting because I didn't want a lot of church-imposed dogma. I remember teaching a Bible study class to teenagers, and as far as I was concerned, even back then, it was like we are all an atom in the body of the universe. In other words, I felt like we are an insignificant part of a whole. I was satisfied with being that. Now, with all the discoveries they've made, we're probably not even atoms.
Right.
Now that our knowledge of the universe has expanded so much, I'm just a natural part of the whole. You're born, you live as well as you can, and you die. There's certainly an awful lot of beliefs about what is and isn't, but nobody really knows.
It almost takes the pressure off to recognize how insignificant we are.
Exactly.
You know? Yeah.
Exactly. And to be perfectly comfortable with that. Yeah. I'm just happy to be alive. And certainly hasn't been a perfect existence, but it's all part of part of being. Yeah.
Yeah.
I can't do at 86, I can't do what I did before, certainly physically. That you've got to recognize. It's no sense sitting around moaning because you can't ski anymore or something, or ride your bike. Otherwise, it takes all the joy out of life. And to me, it's very, very important to allow yourself to feel the joy of being alive because, God, it's wonderful.
Remember how Alice uses the word deteriorate to talk about her body and the aging process? The negative implication that this word may have for most people doesn't seem to touch her psyche in any way at all. Her context for her own reality of aging is so full of gratitude and joy about being alive, engaged and active at 87. It's almost like there's just no room for despair. Maybe embracing the reality of decline is exactly what allows for the joy.
Come alive, it's more than breathing. Have to wrestle with your soul. Show it that you're close to understanding. Don't give up and think you're too old. And then after all the fun is over, you will still have all the memories. Come alive and see the wood through all the trees.
That wraps up another conversation about everyday pain. Please join me for another episode next week with more explorations of why it hurts, how to make it stop, and keep it from happening again. If you have thoughts about this episode or you want to share your own experience with pain, please join our growing community at the Everyday Pain Forum on Facebook groups. If groups aren't your thing, you can just like and follow the Everyday Pain Guide Facebook page or check out tweets by @NoEverydayPain. Organized Sound Productions is responsible for the serious audio magic that makes these episodes work. Our theme music is by Eric and Magiel, and you can check out the other artists and businesses featured in this podcast by going to stopeverydaypain.com, where you'll find all the episodes and more. For privacy, when requested, guests' names are altered. Please also remember these episodes are never intended to serve as medical advice. Thanks so much for listening, and until next time, I hope you also find a way to connect and talk about your own pain.